Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. A big thank you to all who have subscribed to this channel. This is a channel where we educate ourselves on common health problems. So if you're new to this channel, please don't hesitate to hit on the subscribe button and also on the notification bell so you don't miss anything that I upload. In the next few weeks, I'm going to be spending some time with you talking about diabetes. Diabetes is a very broad topic. So what I'm going to be doing is dividing it into little chunks so it will make it easier to understand. So please make sure you don't miss any of my series on diabetes because it's going to be very interesting. So today I'm going to be spending some time with you talking about the different types of diabetes and the factors that can put you at risk of developing these forms of diabetes. So let's get on. Diabetes is a condition that causes a person's blood sugar levels to become far too high. When you eat a carbohydrate, your body turns it into a simple sugar called glucose and sends that to your bloodstream. The pancreas is a large gland behind the stomach, and embedded in the pancreas are the islets of Langerhans, which secrete into the blood the hormone insulin and glucagon. Insulin helps move glucose from your blood into your cells, which uses it for energy required for your daily activities. When the amount of glucose in your blood rises to a certain level, the pancreas will release more insulin to push more glucose into the cells. This causes the glucose levels in your blood to drop. And to keep your blood glucose levels from getting too low, your body signals you to eat or release some glucose from storage kept in the liver. Diabetes is a lifelong disease and it occurs when one of the following happens. One, when the pancreas does not produce any insulin at all. Two, when the pancreas produces very little insulin. And three, when the pancreas does not respond appropriately to insulin. And this is a condition called insulin resistance. There are two main types of diabetes. We've got type 1 and type 2 diabetes. And there are two other types called gestational diabetes and pre-diabetes. Now let's talk about type 1 diabetes. Type 1 diabetes starts normally at an early age, commonly starts in people under 20 years, but can occur at any age. It is also known as early onset diabetes. It is less common and occurs in about 10 to 15% of diabetes sufferers. Type 1 diabetes occurs when the insulin-producing cells of the pancreas are destroyed by the immune system. People with type 1 diabetes produce no insulin and must use insulin injections to control their blood sugar. Now, let's talk about type 2 diabetes. Type 2 diabetes is far more common than type 1 diabetes and occurs in about 85 to 90% of people with diabetes. Even though it is sometimes referred to as the adult onset diabetes, type 2 diabetes has started to appear more often in children because of the rise in obesity in young people. Unlike people with type 1 diabetes, people with type 2 diabetes produce insulin. However, the insulin their pancreas secretes is either not enough or the body is resistant to the insulin. When there isn't enough insulin or the insulin is not used as it should be, glucose can't get into the body cells. Some people can manage their type 2 diabetes by controlling their weight, watching their diet, and exercising regularly. Others may also need to take a pill that helps their body use insulin better or take insulin injections. Now let's move on to prediabetes. Prediabetes is also called borderline diabetes, sometimes referred to as impaired fasting glucose or impaired glucose tolerance. or impaired glucose regulation, or sometimes non-diabetic hyperglycemia. They all mean the same thing. Prediabetes occurs when you have blood sugar levels that are higher than normal, but not high enough to be classified as diabetes. People with prediabetes usually have no symptoms, but it's almost always there before a person develops type 2 diabetes. However, complications normally associated with diabetes, such as heart disease, can begin even when a person has only prediabetes. Talk to your doctor to see if you need to be tested for prediabetes. You may be able to prevent type 2 diabetes and lower your risk of complications like heart disease. The good news is you don't have it yet, and there are lots of things you can do to prevent or delay type 2 diabetes from developing. Now, the last type of diabetes, gestational diabetes. Gestational diabetes is diabetes diagnosed for the first time during pregnancy. This can happen at any stage in pregnancy, but it's common in the second and third trimester. Like other types of diabetes, gestational diabetes affects how your cells use sugar. This happens when your body cannot produce enough insulin to meet your extra needs in pregnancy, and this causes the blood sugar levels to rise. This can affect your pregnancy and your baby's health. Gestational diabetes can be quite concerning, but the good news is that eating healthy, mild exercise, and if possible, taking medication can help control it. Controlling blood sugar levels can keep you and your baby healthy and prevent a difficult delivery. In women with gestational diabetes, blood sugar levels usually return to normal soon after delivery. But if you've had gestational diabetes, you have a higher risk of getting type 2 diabetes, and you will need to be tested for changes in blood sugar levels more often. Now we move on to the second part of this chart. We are going to be talking about the factors that can put you at risk of developing these forms of diabetes. So now let's start with type 1 diabetes. Known risk factors for type 1 diabetes include family history, that is having a parent, a brother, or a sister with type 1 diabetes. Age is also a risk factor. You can get type 1 diabetes at any age, but it's more likely to develop it when you are a child, a teenager, or a young adult. There are quite a few factors that can put you at risk of developing type 2 diabetes, and these include being overweight or obese. The more fatty tissue you have, the more resistant your cells become to insulin. Inactivity is also another factor. The less active you are, the greater your risk. Physical activity helps you control your weight, use up glucose as energy, and makes your cell become more sensitive to insulin. A family history of diabetes is also a risk factor. That is, if you have a parent, a sister, or a brother with diabetes. Race or ethnicity is also a risk factor. Although it is unclear why this happens, people of a certain race are more at risk than others. If you are of Asian, Afro-Caribbean, or Black African origin, you are at a greater risk than someone who is not. Also, if you have blood pressure or abnormal cholesterol level, that can put you at risk of getting diabetes. Age is also a risk factor. If you're over 40 years or 25 years for South Asian people, your risk of developing type 2 diabetes increases. Risk increases because it could be that you exercise less and gain weight as you grow older. And if you've previously had gestational diabetes or pre-diabetes, that also increases your risk. And people who suffer from polycystic ovary syndrome are also at risk of developing type 2 diabetes. Polycystic ovary syndrome is a common condition that occurs in women and is characterized by irregular menstrual period, excess hair growth, and obesity. You're more likely to suffer from gestational diabetes if you're overweight and obese, you lack physical activity, and you've previously had gestational diabetes, or you are pre-diabetic. If you suffer from polycystic ovary syndrome and you have a family history of diabetes, and if you have previously delivered a baby weighing more than 9 pounds or 4.1 kilograms, race is also a risk factor in women who are of Black African origin, Afro-Caribbean origin, Black American, or Asian origin have a higher risk of developing gestational diabetes. And you are at risk of developing pre-diabetes if you're overweight, you're 45 years or older, you have a parent, a brother or sister with type 2 diabetes, you are physically active less than 3 times a week, you have had gestational diabetes, and you are of African American, Afro-Caribbean, or of Black African or Asian origin. All these factors can put you at risk of developing pre-diabetes. Apart from type 1 diabetes that require insulin for management, all the other types of diabetes can be managed by making some lifestyle changes. And diabetes is a very interesting topic, and I would advise that you don't miss any of my next few videos. We'll be looking at some symptoms of diabetes, some non-medicinal ways of managing diabetes, and I would also be talking about some of the common drugs that are used for the management of diabetes. I'll be very glad if you come along with me by subscribing and hitting on the notification bell so you will be notified anytime I release a video. Thanks so much for your time today, and I hope to see you soon in my next video. Bye for now.